story to share today itself, and it just shook me from my core.
Hmm.
I was having a conversation with an Indian medical graduate. Okay, and this person just started speaking ki foreign medical graduates, so these people don't really know anything. That's why they had to go to another country. They are not really, मतलब, they are not meant उस तरीके से, मतलब they are not applicable in some ways. That's why they had to go to another country, or either they are not rich enough that they can get admission in private colleges. And I was like, dude, what do you mean? That just shook me to my core ki j-
Yeah.
just because we people are studying in another country doesn't mean we don't have that kind of buddhi nahi hai, dimag nahi hai, we don't have brains or something like that. Dude, you know how many problems we go through when we go outside.
Hmm.
Apna we manage our own expenses, and many people work and study also, especially the Sri Lankans. And people handle their relations by themselves, people handle their work by themselves. Even if there is snowing, they still go. And even if there are times ki you just don't know how to do it, you don't want to stress your parents out also. So
Hmm.
people don't call their parents and tell, okay, this problem is going on, that problem. They are in a whole different world, they get a whole different exposure, and
Yeah.
unfortunately, when they go to some universities, they don't even teach the basics. So
Hmm.
welcome to foreign medical graduate life. And that's when I want at least the people whom I talk to, and I know the people, yani, just for you guys, you came in, you actually took a step forward. Yes, I want to learn something, and I really want to go for it. So I'm so proud of you. And how about let's start? Let's start on a good note. That let's not let the name of foreign medical graduates down. Last year, NEET PG ka 10th rank was by an FMG. So it's not like you're less than anybody, okay? Never let anybody else degrade you. You know what I told to this person? Dude, you are nobody to tell me my own worth. And I would like to end this conversation here. And I blocked this person. No need to hassle. अपना इज्जत गिराने की जरूरत नहीं है. Okay. So let's get to emergency room. Let's get to ECGs. The basics. Is in this lecture, our goal is ki a normal ECG should be clear to you. Why? So I have examples of two of my patients who came in emergency department. So first patient, she came in with डॉक्टर साहब छाती में बहुत दर्द हो रहा है, बहुत दर्द हो रहा है. She was just so in so much agony, she was in so much pain, and she was having palpitations also, कि दिल छाती के अंदर जोर जोर से धड़क रहा है. So palpitations, you can feel your own heartbeat. And she was just looking so sweaty and so little bit pale also. And you know what? People with heart problems come with this one specific word, and you write it in your clinical symptoms, ghabrahat. So everybody understands what does ghabrahat mean, right? Ghabrahat, right? And then we were in a hurry. We as soon as she came in, we took her ECG, and we were reading the ECG, and it was normal. Everything was normal, but she was having legitimate chest pains, really sweaty. So this is why you need to know ECG. She could मतलब उसको हो सकता था कि पॉसिबल है कि उसको एमआई हो रहा होता, कुछ भी हो रहा होता. सो एमआई इज मायोकार्डियल इंफार्क्शन, वेयर हार्ट का मसल is not getting oxygen, okay? Yani not getting blood supply, so not getting oxygen also. It will die in some time. And another patient, I remember, this patient came आराम से हिलता डुलता and came in, and डॉक्टर साहब ये मुझे रैश हो गया है, मेरा रैश देख लो. अच्छा, हमने पूछा वैसे सब ठीक है. And usually we do normal examination. We auscultated his heart also, and we heard something different. And we did a ECG for him. And then his ECG was like, dude, his ECG was crazy. Okay, he could have, just collapsed if he would go outside. That kind of ECG he had. So his heart rate was really less. It was around 36 to 40. It was varying. So a normal heart rate is 100 to 60. Okay. And his was 36 to 40. and his brain was not getting enough oxygen. He's like, डॉक्टर साहब बस ये रैश ठीक कर दो, दिल का तो मुझे कोई फर्क नहीं पड़ता. That person was having a heart block. So we need to know and that's why we need normal ECG पता होना चाहिए अपन को to rule out. So let's start. Let's go on. सबसे पहले, even before we start anything, I really want you to know the structure of heart now. So everybody here understands थोड़ा थोड़ा structure of heart. थोड़ा थोड़ा I'll do anatomy revision also. So you'll remember everything ना. Heart में above there are two chambers. Both are called atria. Okay. This is your. I'll use different color. This is your atria. This is your atria, and below are the ventricles. Right. Between atria and between ventricles, there is this valve. Do you see this valve? And other side also. Between atria, between ventricles, there is this valve. And then there is left atria, there is right atria, left ventricle, right ventricle. Done? Simple, simple ekdam. One atria and another atria, they do not communicate with each other. There is a septum. You see it? One ventricle, another ventricle, they do not communicate with each other in normal people, and there is a septum. You see it? Okay. Now we'll see this chota sa blue dot. You see this? This another blue dot. These are the most important two structures. So heart has different type of cells. Filal will talk about three most important cells. First of all, these pacemaker cells. We have two pacemakers in heart. This wala is SA node. Okay. And this wala blue is AV. So SA is sinoatrial node. Done? It is ये दिख रहा है तुम्हें ये blue वाला वेसल. दिस इज सुपीरियर वेना कावा. दिस इज इंफीरियर वेना कावा. ये दोनों एट्रियम में ड्रेन होती है. ऊपर ऊपर से जान लो. डोंट गो इन डेप्थ राइट नाउ. मे बी इन सम अनदर वीडियो, सम हार्ट रिलेटेड वीडियो, आई विल डू इन डेप्थ ऑफ हार्ट एनाटॉमी. जस्ट थोड़ा थोड़ा जान लो, नॉट नॉट सो मच इन डेप्थ. सो यहाँ पे अपर वॉल में है साइनो एट्रियल नोड, एसए नोड, एंड एट्रियम के बेस वाली वॉल में अपना एवी नोड. What else did I want to say? हाँ ठीक है, डन. अब these are the pacemakers of the heart. इनको connect करने के लिए we'll have connecting bundles. Connecting bundles, they also carry electrical impulses. In nodes में the impulse will be generated. The impulse will be carried by the conducting bundles. Okay, the conducting bundles, ये sinoatrial, so you can see these three bundles going towards AV and one bundle going towards the right atrium, right? So what happens is this AV node is wafadar. So wafadar means loyal. This AV node is really loyal to SA node, and this SA node is the boss. This boss loves AV node also. So it's gonna transmit all his impulses towards the AV node. तो boss क्या करता है? Boss has a wafadar, a loyal right-handed person, and boss has some servants also. ये servant कौन है? It has these four servants you can see. This one, this one, this one, this one. So one servant he particularly hates a lot. So this is the long servant. He has to go this long distance towards the left atrium and carry impulse there. And this man is doing a lot of work. This man is having a lot of, you know, zimmedari on his back. So a lot of zimmedari, क्या कहते हैं English में? My English has become so bad after sitting in. Yes, after sitting in general OPD, now you start explaining things in Hindi. Sometimes you don't remember English words. So yeah, has a lot of responsibility on his back. Hence the name is Backman's Bundle. Okay, you can write it. यहाँ पे लिख सकते हो छोटा छोटा. It's Backman's Bundle. Okay, and these other three servants, they have the shortest route. बहुत आराम से they can go and do their work. And these three short bundles are internodal bundles. Okay. Done. And this Wafadar AV node. Let's talk about this loyal AV node right now. It is so loyal that he knows that boss is not gonna appoint somebody else. So I can do my work as slowly as possible. So It delays the electric impulse. Understood? It's going to delay the electric impulse, and niche it's going to transmit the electric impulse to the singular pathway. Hello, Prajwal. So Prajwal is my co-intern actually. Welcome, dude. So this chota sa singular bundle, you can call it bundle of his. BOH, we write short form, bundle of his. Okay. So this person again has two more servants. It's gonna give the work to these two branches that you see here. This is left bundle branch and this one is right bundle branch. Let's name them. See, you're gonna remember this so you can write short forms also. No need to write pura full forms. Left bundle branch and this one is the right bundle branch. And the last people, the last in the chain who are supplying these impulses to the cardiomyocytes are who? They are called Purkinje fibers. These chota fibers, these small fibers you see, these small fibers. Where should I write? Okay, I think I'll write it somewhere here. Purkinje fibers. Am I clear? Okay, now let's complete होने के बाद, I just want you guys to look towards me. Starting with essay note, it's the boss, and it has four servants and one loyal shikar. Okay, so the boss is going to send four servants for this work, but one servant he hates. It has the longest pathway, hence the name is Pac-Man's bundle. It goes towards the left atrium. Okay, यहाँ से ऐसे node से impulse started and slowly it's gonna go and depolarize along its way, and the impulse will go to AV node. From AV node, the impulse will go to bundle of his. From bundle of his the impulse will go to left bundle branch, right bundle branch, and then it will go to the Purkinje fibers in the end. Done? Yahan tak understood. This is the most basic part. And now about what is depolarization and repolarization. You must have studied it in physiology. But हम छोटा सा रिविजन करेंगे बिल्कुल इतना सा. तो depolarization है positive charges का movement. Okay. अगर याद आ रहा हो तो sodium moves in. Sodium is positive. Calcium moves in. Calcium is positive. So this is depolarization. Repolarization is when membrane returns back to its resting membrane potential. Resting membrane potential yani negative charge. Okay, membrane becomes negative again. So depolarization, membrane is becoming positive. Repolarization, membrane is becoming negative again. Done? The chota sa concept is clear, I think. Okay, let's continue. So basically, ECG electrocardiogram is based on the principle of galvanometer. Galvanometer क्या करता है? What does it do? It measures the current का direction. Okay, what's happening with the current? And with amplitude, उससे पता चलेगा कि कितना amplitude है. हाँ, galvanometer. Galvanometer. You must have read about voltages in your physics वाला class ना long ago. तो उसमें there is a positive pole and then there is a negative pole, right? So positive pole, yeah, positive pole we call it the exploring electrode, and negative pole is called the reference electrode. And I'll tell you why this terminology is, where did it came from? Okay, so vectors. Um, the concept is based on vectors. So yeah, so this is the negative pole and this is the positive pole. So basic chota funda I'm telling you, and this is so important, and this is the basis of ECG. If positive charges are moving towards positive terminal, you will see a positive deflection. So positive charges are moving in a positive direction. we'll see a positive deflection. Okay. Again, negative, positive. So positive charges are moving in a positive direction. You will again see a positive deflection. Another one. So positive charges are moving where? It is perpendicular, right? So what will happen? You will see a positive deflection and you will see a negative deflection. This will cancel out each other and you will see a straight line. This is all about vectors. Okay, this is nothing कि भाई बहुत ज्यादा technical कुछ है छोटा छोटा positive moving in positive direction it is positive. Okay, अब क्या होगा if this is negative and this is positive and positive charges are moving in opposite direction. So what kind of deflection we'll see? We'll see a positive deflection or a negative deflection. What do you guys think? Negative, yeah. We will see a negative deflection. And what if negative charges are moving in negative direction? This is the tricky one, okay? You'll get a positive deflection. Okay, let me tell you why. See, negative charges are going in negative direction. So automatically this is becoming more positive, right? यहाँ से negative हटा दोगे, so this will become more positive. If the negative charges are moving in this direction, this will become more positive. So again, positive. So छोटा सा gist is this: same charges moving towards the same pole will give a positive deflection, and charges moving towards the opposite pole will give a negative deflection. छोटा SA node will depolarize. So what is depolarize? यानी impulse will start from here. ठीक है? So SA node will depolarize. But इतना छोटा amplitude होता है, the amplitude is so small that it's not visible. And then after SA node's depolarization, what will happen? Right atria and left atria will depolarize. So direction कहाँ जा रहा है? खैर direction we'll talk later. थोड़ा बाद में बात करेंगे. अभी सिर्फ depolarization देखते हैं. Right atrium towards the left atrium depolarization होगा and we will have a P wave. Do you see this छोटा सा P wave? And we'll see why it is a positive deflection later on. And then there is depolarization of AV node and bundle of his. ये Purkinje fibers काट देना इसमें. ये oh shit, I removed everything. My mistake. रुको let me. Oh yeah, done. Yeah, so AV node and bundle of his will depolarize, and as you remember यहाँ पे there is slowing of conduction. This is physiological, this is normal. So we'll have a straight line. Do you see the straight line? PR segment ECG में this one. फिर उसके बाद there will be right ventricle का and left ventricle का depolarization, and you will see this QRS segment. And then उसके बाद there will be ventricular repolarization. And then you will see ST segment and T wave. एंड में कभी कभी इन सम पीपल वी स्पॉट दिस छोटा सा यू वेव आता है यहाँ पे इतना छोटा सा यू वेव आएगा एंड व्हाई वी सी दिस बिकॉज late papillary muscle repolarization. Do you know what is papillary muscle? So if you look at this heart, ये जो इसका ये है वॉल्स है इस वॉल्स को पकड़े हुआ है ये एक मसल है यहाँ पे ओके एंड देन इट जॉइंस बाय अ टेंडन सो ये मसल का नाम पैपिलरी मसल है I told you about everything but left this छोटा सा part. Atrial repolarization is hidden. ये QRS वेव में ना कहीं एट्रियल रिपोलराइजेशन की एक पॉजिटिव वेव भी है जो हिडन है व्हाई सो दिस इज बेसिक रूल ऑफ ईसीजी नंबर 1 कि Bigger events will hide the chota wala events. So the bigger events will hide the smaller events. So atrial repolarization is a very small event. So it is usually, yani it is always hidden by the QRS complex. Then let's continue. Standard speed of ECG की बात करेंगे. If you go to the last page, यहाँ पे नीचे there is written the speed of the ECG. This is 25 mm per second, right? This is standard speed of ECG. ये छोटा छोटा ऐसा लर्न करने वाला चीज है. Okay, it's just some things that you should know when you see a ECG का report. So, what is heart rate and what is a normal heart rate? And right now we'll learn how to calculate the heart rate through ECG. Heart rate is the ventricular depolarization rate. Understood? Yani ventricle depolarization. Or also one more thing. ECG only measures the electrical events. It doesn't measure the mechanical events. Mechanical events का मतलब है systole and diastole of heart. Systole यानी contraction, diastole यानी relaxation. ECG only does the electrical part of it. इसका mechanical part देखने के लिए other investigations. So अपने हिसाब से अगर ventricles depolarize हो रहे हैं तो अपन को QRS दिखेगा, right? You can see the QRS here. See, this is the QRS. What we do is we'll mark this R to R interval here. Again, इस वाले में भी we'll mark R to R वाला interval here. अब let's see कि इसमें हम कैसे calculate करेंगे heart rate. छोटा सा फंडा ये है कि अपना जो smallest square of ECG है ना, इसकी जो width है it's 0.04 seconds and the height is 0.1 millivolt. Okay? So one small square, 1 mm is equals to 0.04 seconds and height 1 mm is equals to 0.1 millivolts. तो 1 minute में अब तुम ये देखना, डू यू रिमेम्बर द स्पीड वाज 25 mm per second. तो 1 minute में कितना सेकंड है? 60 सेकंड है. एक एक सेकंड में स्पीड इज 25 यानी 25 छोटा छोटा वो बॉक्सेस इट विल कवर. सो 1 minute में देयर विल बी 1500 mm. सिंपल सा फंडा है. हार्ट रेट कैलकुलेट करने के लिए 1500 डिवाइडेड बाय आर आर इंटरवल इन मिलीमीटर्स. दिस इज योर वेंट्रिकुलर रेट. And usually ventricular rate is the heart rate. But in some circumstances, आर्टरी अपना मन मर्जी से कॉन्ट्रैक्ट कर रही है, वेंट्रिकल अपने हिसाब से कॉन्ट्रैक्ट कर रहे हैं, तो दोनों का यूं यूं और ये सब डिफरेंट होगा. तो उस केसेस में हम वेंट्रिकुलर रेट हमें अलग पता लगता है, एट्रियल रेट अलग पता लगता है. तो सेम एट्रिया का रेट निकालने के लिए 1500 डिवाइडेड बाय पीपी इंटरवल इन मिलीमीटर्स. ये पीपी इंटरवल कैसे निकालोगे? डू यू स्पॉट द पी वेव इन दिस? ये छोटा सा and this another one chota sa. Either you take from the starting of this P to starting of another P or from ending of this P to the ending of this P. Understood? QRS का हम लोग पीक से लेते हैं ऊपर से. Done? अभी I have a hack for you. I don't want you to be like एक दो तीन चार डब्बे गिन रहे हैं कि कैसे निकाले हार्ट रेट कितना है. छोटा सा हैक टू फाइंड ब्राडीकार्डिया एंड टैकीकार्डिया. सो नॉर्मल हार्ट रेट है अपना 60 to 100 beat per minute. अगर इसको if you'll convert into the millimeters वाला चीज ना, you'll get की heart rate around 3 to 5 big boxes के बीच में आना चाहिए. अगर 5 से ज्यादा आ रहा है तो it's called bradycardia. Bradycardia यानी decreased heart rate. Okay? 5 big boxes ज्यादा है इसका मतलब 60 से कम है heart rate. If it is less than 3 big boxes, so heart rate is more than 100. Done. So in these two ECGs, can you spot which one is tachycardia and which one is bradycardia?
The first is Taki and the second one is bradycardia.
Correct. Yeah, that's right. Correct. So this is one of your spot diagnosis for OSCE. ठीक है? You're seeing ऐसा नहीं millimeter 1500 divided by no. Just see if it's more than five big boxes, this is brady. Less than three, this is tachy. I'm so sorry for my handwriting. It's so interesting, right? अरे यार. So yeah, अभी हम लोग लीड लगाना सीखेंगे. So ECG करते time, for example, you don't have nurses around and you need to do emergency ECG, and right now you cannot order any nurse. A nurse ECG का लीड लगा दो, ECG का स्ट्रिप निकाल के दे दो. So what you need to do is you need to do it by yourself. कैसे करेंगे? And I want you to remember this. So a lot of people in this world want to become Gora. Okay, fair tone. And do you see the a lot of people also थोड़ा सा वैसा थोड़ा सा डार्क हो जाएगा, but कोई बात नहीं. If it's helping you to remember, then it works. So and then they use fair and lovely in their hand. So fair and lovely कौन से कलर की होती है? White. They have white fair and lovely in their right hand. So white in right. Done? Okay. So white का उल्टा क्या है? Another hand you just have black lead. And then hands का हो गया white in right. Opposite वाले में you'll have black. अपना जो left leg है, that is the most important leg. We are gonna have it in red because heart का जो vector है, you'll remember it. Don't worry. अभी तुम्हें लग रहा है क्या vector, you'll remember it as soon as I go forward. Heart का vector points towards the left leg. So left leg is the most important leg. So you will remember it as red. Okay. And then right leg is just useless. And since it's useless, we will use it for earthing. And earth ka color will think of it as green. Let's hope ki coming years may it'll be more green. So right leg, it's gonna have green color. Are we done? White and right. Opposite one will have black. The most important leg is left leg, the red one, and green will be put on your right leg. Okay, now let's continue. So do you remember I mentioned positive pole is called the exploring electrode half an hour ago. Negative pole is called the reference electrode. Now we are going to talk about it more. And also we are going to talk about the depolarization of heart in two directions. Two planes, sorry. So one is the vertical plane in this, and another one is the horizontal plane. Okay. Vertical plane, the direction goes from SA node towards the AV node and then towards your Purkinje fibers. And horizontally, the direction goes from endocardium towards epicardium. So do you understand what is endocardium and epicardium? Yani, these are the muscular layers of heart from inside towards outside. Okay, so direction is somewhere like this. Okay, the vectors are like this. This is my arrow, so vectors are like this. And in the vertical plane, the vector is like this. If this is the arrow, the vector is like this. Okay, the end, it has 12 leads. Okay, it seems like a lot, but you're gonna remember it after this session. Yani, 6 leads are the limb leads, these limb leads, and 6 leads are horizontal chest leads. Okay, 6 leads vertical, 6 leads horizontal. लीड की बात करते हैं. लिम्ब लीड्स में ऑल्सो देयर आर टू टाइप्स ऑफ लीड्स. एक तो बाइपोलर लिम्ब लीड्स एंड यूनिपोलर लिम्ब लीड्स. डोंट वरी, इट इज रिटन देयर एक्चुअली. सी इट्स पिंक में बाइपोलर लिम्ब लीड्स. या राइट. सो लीड नंबर 1, 2 एंड 3, these are bipolar limb leads. अब ध्यान से देखना, will connect all these limbs. यानी अभी हम एक लिम्ब में पॉजिटिव, एक लिम्ब को पॉजिटिव बनाएंगे, एक लिम्ब को नेगेटिव बनाएंगे. and we'll see how it will go. Lead number 1. Your right upper limb is negative and left upper limb is positive. And do you see the direction of the vector of heart? So your heart is depolarizing in this direction, in this direction. So positive charges are moving in this direction, right? So you will have positive P and QRS. So why I have written less positive? I've written it as less positive because अगर ये पूरा पूरा ऐसे होता, if you remember vectors थोड़ा थोड़ा physics, तो you will see the maximum deflection. बट ये थोड़ा सा इस डायरेक्शन में जा रहा है. अगर हम इस वेक्टर को तोड़ेंगे तो कुछ इस डायरेक्शन में दिखेगा and a little bit of it will be visible in this direction. So this direction this galvanometer will pick. That's why it's a little bit less. Okay, but it will be positive. Understood? So lead 1, things are positive. And then another छोटा सा concept I want you to see. जहाँ पे भी positive electrode है, this is your which one? Exploring electrode, right? And the negative one is reference electrode. Exploring यानी हम इसको explore कर रहे हैं. Explore कर रहे हैं यानी हम इसको देख रहे हैं. Exploring means we are trying to look at it. Okay. So if we are looking at it, if this is your eyes, so this concept I took from Ninja Nerd. If this is your eye, which wall of the heart you are seeing? This is the lateral wall of the heart. So that's why in lead 1, if we see problems, the problem will be from the lateral wall of the heart. Done? You don't need to memorize lead 1 is equals to lateral wall. No, just understand the concept. Let's continue towards the lead 2. अभी lead 2 से देखना. Lead 2 में left lower limb positive है. So left lower limb is the exploring limb and right upper limb is the reference electrode. It's written there. You don't need to write it, okay? And the direction of the vector of the heart is also in the same direction. So what do you think? There will be the maximum deflection. So this is the best electrode to study diffuse changes in ECG. Okay? Best electrode. So it's written best for diffuse to look for diffuse changes in ECG. अब ये मैंने axis और degree क्या लिखा है? This lead number 1 is in horizontal direction. तो हम इसको as a यानी ग्राफ में जैसे एक्सिस होता है ना x axis y axis, so we take it as x axis and then this lead 2 is on this axis and the angle between 1 minute. So this is lead 1, this is lead 2. So angle between them is 60 degree and I have written positive 60 degree which I'll explain to you later. Just understand abhi ke liye for right now. If you go downwards towards lead 1, the axis will be positive. So lead 2, left lower limb is the exploratory limb. So aankh ka hai? Where is your eye? So we are looking at the heart like this. So which is this wall? This is the inferior wall. So inferior wall is the wall which we are trying to explore, and if there are problems in lead 2, inferior wall is the cause. Lead 3 की बात करते हैं. Exploring electrode is left lower limb and reference one is left upper limb. Heart के vector का direction is downwards and you see the direction of अपना lead 3 का vector also. See? So positive charges are moving towards positive. So the deflection is positive but less positive because it's not in pura direction. Done. And again, we are looking from here. We are looking at the inferior wall. So again, lead 3 will detect the inferior wall. And can you see something very interesting? in all these three leads. Don't you think lead 1, lead 2, and lead 3 together are making a triangle structure? You see? This one it is. Lead 1, lead 2, and lead 3. So this triangle is called Einthoven's triangle. This is some theory-based stuff, okay? Just I think you should know it. That's why I told. But ये अपन लोग इतना as such इस्तेमाल नहीं करते. It's good for you to know. Lead 1, lead 2, and lead 3. Guys, do you want a break or should I continue? Do you want a 5-10 minutes break
No, no, no,
or
it's
should I
fine.
keep on? It's fine. You are still
Yes,
awake?
yes, yes. Yeah, I'm here.
Okay, okay. चलो ठीक है. Let's try to speed things up. Unipolar limb leads. So unipolar limb leads में क्या होता है? इनका हम nomenclature ही बहुत special है. So I've written A, V, and dash. A means augmented, V means voltage, and उसके बाद जो हम letter लगाएंगे, the letter which we'll put afterwards will be the letter of the exploring limb. So what happens is we have an exploring limb and then another limb, another electrode. The reference electrode will be the sum of these two uh, reference electrodes. Okay, let me explain you with this example. So this is left lower limb, this is left upper limb, and this is right upper limb. Okay, so right upper limb is the exploring electrode. One minute, my pen stopped working. Yeah, right upper limb is the exploring electrode, and the reference electrode is the sum of left lower limb and left upper limb. तो इन दोनों का sum करेंगे, इनके बीच में distance निकालेंगे, and from this distance we'll draw the vector. So you see a little bit direction of the vector has changed, right? So exploring limb is right. So that's why the name is AVR. And in this one, another one, you see, exploring limb is left upper limb. That's why the name is AVL. In this one, the exploring limb is left lower limb. That's why the name is AVF. AVF yani F ka matlab here is F means foot, towards the foot. So we have two special leads here. ये देखो, the AVF वाला, the AVF is in perfect vertical direction. So we will take this AVF as y-axis. Do you remember what was the x-axis? It was the lead one. And the y-axis will be AVF. So छोटा सा, can we plot here? Mm, This is AVF and this is lead one. Okay. That's why. Do you remember I just said कि downwards the angle will be positive because you see why. I think you must have understood why. So this is called the axis of the heart, and we'll talk about it a little bit later, but you'll understand more. Slowly we are building up really important concepts for you now. So AVR की बात करते हैं. This is the most outcasted limb, lead of all. Okay, this AVR, what happens is this black colored vector is the vector of the heart. And this red color wala is the vector of the lead. So galvanometer will try to measure what is happening is ये positive charges का movement है, and do you see the positive charges are moving away from the positive pole, right? So what will happen? The P and QRS will be negative. Did you get what I'm saying?
Yeah.
So this lead is totally opposite of lead 2. The things you will see in lead 2, बिल्कुल opposite in AVR. And I think I should let you guys spot it right now in this ECG. So can you guys see the lead 2? This one is the lead 2. And can you spot the AVR? Totally ulta ulta. See? Very small. ये छोटा सा P wave दिखेगा तुम्हें. यहाँ पे देखो P wave is ulta. There is this QRS upwards, QRS downwards, T upwards, T downwards. Total opposite of lead 2. This is the only outcast lead of in सब में से. Okay. AVL again. This black is the direction of the vector of heart, and this red one is the direction of AVL lead. Reference electrode कौन सा है इसमें? Right upper limb and left lower limb. And exploring is this one. So again, positive charges are moving towards the positive pole, so we'll see positive deflection. AVF lead. The reference electrode is right upper limb and left upper limb. इनके बीच में you'll join it, find the center point, again draw the vector towards the left lower limb, and left lower limb is the exploring lead. This black wala is heart ka vector, so positive is moving towards positive again. So PQRS is positive. And you understand why it's less positive, right? Let's move on. Let's move on to the last 6 leads. And these leads, people really confuse them a lot because ऐसा लगता है कि बस छाती पे कहीं पे भी लगा दिया है. But it has a way, okay? You need to find a way how to put these leads. So the thing is for AVR, so this is the right upper limb. This is the exploring electrode. So we have an eye here, right? And
Yeah.
this is your heart. So the part which we are looking so nicely is the septum of the heart. So that's why for AVR is for the septum of the heart.
Hmm.
Okay. And AVL, again, we have an eye here. This is your heart. And this is the lateral wall of the heart. So AVL will again look at the lateral wall of the heart. Okay. And AVF, left lower limb, we have an eye here. This is your heart, and it is looking at the inferior wall of the heart. So what we are trying to do is we are trying to catch heart from different directions. You see, so left, if you remember, this is the direction of the lead 2. This is the direction of the lead 3, right? And this is the direction of the this AVF. So we are trying to look at the heart from different directions so we can catch the abnormality. Okay. Did I answer your question?
Oh yeah, I get it. Yeah.
Precordial chest leads. How we will put them? First of all, you will identify a line between the nipples. Okay, that's your fourth intercostal space. And at those places, first of all, you'll put V1 and then you'll put V2. Okay, just beside the sternum, you'll put V1 and then you'll put V2. And then V3 you'll skip. Okay. You will go to the fifth intercostal space, and then this is your clavicle. So between the clavicle, there passes a mid-clavicular line. So at the mid-clavicular line on the fifth intercostal space, you will put your V4. Okay. And then V3 we put between V2 and V4 again. So we are remembering, oh, V3 existed. And then after it, you have V5 and V6, same fifth intercostal space. You're going to put on anterior axillary line. So axilla you divide into 3 lines. Anterior, in the middle is middle axillary line, and posteriorly there is posterior axillary line. So we put on anterior axillary line V5 and middle axillary line V6. I think that's done. That's done and dusted. You don't need to remember it right now. बिल्कुल अभी के अभी याद रहेगा. Just try to spot them on any of your male friends if they let you do it. Okay, you'd be like, okay, V1 is here, or if you have a boyfriend. Okay, so let's continue. Hmm, about the chest leads. इनका ये वाला electrode तो you understood, exploring electrode. So see, the vector will be in these directions. V1, V2, V3, V4, V5, V6. See, this is the arrow, right? V1, V2, V3, V4, V5, V6. So in horizontal plane, we are checking the activity of heart. Exploring electrode यहीं पे है, जहाँ पे हम electrode लगा रहे हैं. But where is the reference electrode? So the reference electrode is the sum of all three. So let me tell you how. This triangle we made, right? Oh, this is not a triangle. This is a triangle. This triangle we made, right? Left lower limb, left upper limb, right upper limb. And in तीनों का sum, the sum of all these three, it will somewhere be here in the heart. So heart में vertically there is an imaginary point which is thought to be at the center of the heart, and वहां से from that point we are taking the reference electrode and we are measuring this current. Okay. So wall of MI की बात करते हैं अभी तक. It's a छोटा सा summary. This you don't need to remember right now at this moment. This you will learn after reading it again and again and again. So trust yourself, trust the process. Lateral wall will see lead number one and AVL. You remember? Lead number one was like this, and AVL was like this. थोड़ा सा. So inferior wall by lead number two and AVF. Do you remember this ये वाला diagram I made? ऐसे वाला vertical वाला. And septum, I just taught you this outcast lead जो दुनिया से अलग चलती है. The septum by AVR. So what about this V1, V2, V3, V4? V1 and V2 is for the anterior wall and septum. So just imagine this is the anterior wall of the heart and V1 and V2 are placed here. So you will look at the anterior wall. And V3 and V4 again anterior wall of the heart. But V5 and V6, usually when we are having left ventricular issues, they are so prominently seen in the V5 and V6. And then there is something called extended leads, yani 15 lead ECG, this V7, V8, and V9. We extend it towards the back, towards the scapula, so that we can capture the problems in the posterior wall of the heart. Okay, so V7, V8, V9 are the extended leads. But यहाँ पे there is no place that I actually wrote right-sided issues of heart. So to measure the right-sided problems, the same V1 to V6 that we put on the left side of the heart, we are going to put it on the right side of the heart. So to spot right ventricular issues, we will put the leads on the right side of the chest. And also right ventricular issues will be spotted in V1. So V1 is here now. So right ventricle is thoda thoda here. So we'll see it in V1 also. Let's get to the actual PQRST. Chota sa is left, not so much. If you understood all this though you are gonna do so easily. So let's take a deep breath and actually start with the waves. Okay, that they're gonna be the easiest part. Just P wave, thoda sa, but otherwise you understand everything. So lead two, the most famous lead for diffuse changes. We'll see what is happening. So this is reference electrode, right upper limb, left lower limb. Okay. So imagine this is patient in front of you. This is his left leg. This is his right arm. And we are going to see the depolarization. So do you remember what was P wave? So P wave was the depolarization of atria, right? And do you remember how it was depolarizing? Look, from SA node, it will go to AV node, right? It's nearer, and the longest distance, it will go like this also, right? So these are two directions, है ना? So first, there will be we will see a depolarization wave for right atrium, and then we will see for left atrium. So right atrium depolarization positive, chota sa, amplitude positive. In which direction? In positive direction again. So positive in positive direction. So what we will see? I'll draw it dotted. So we'll see a positive deflection. Okay, another one. From right atrium towards left atrium. Positive charge movement, again, positive in positive direction. Positive in positive direction, again we'll see a positive deflection. Done. If you combine this wave now, see, what wave are you getting? Did you get it? So this is your P wave. यहाँ पे देखो, पहले है right atrium का component and then there is left atrium का component, but the thing is these components are so close to each other na, they will be visible as one wave only. So the normal height and width of P wave is 2.5 mm. Yani 2.5 small boxes. Okay. Let's look in the V1 lead. So V1, you remember this side. So we can look at the atria. And this is in the horizontal plane. So make sure to look at this very nicely. This is your right atrium. This is your left atrium. And if you remember, depolarization is from inside to outside. And we will mark your lead one. So this is, sorry, lead V1. So this is your V1 lead. Okay. Let's see the direction. So this is the direction of depolarization of right atrium from inside to outside. Okay. So what kind of wave we will see for right atrium? Done. Okay, let's look for the left atrium. The left atrium is थोड़ा सा इस तरफ को, पीछे को. Okay, towards the back side a little bit. So left atrium, it will depolarize like this. So the net vector is like this. So this is V1, this is positive pole, and the net vector is away from it. So the wave will be negative. Did you get it? I think you did. Is there any doubt in this thing? I don't think so. Okay. If there is no reply, I'll just assume there's no doubt. So again, V1, the wave is biphasic, and lead 2, the wave is normal, a normal P wave. Okay. And now we'll talk about something else also. Uh, let's talk about it here. This diagram. So this is the normal P wave. This is PR segment. So do you remember what was PR segment? The wave reached to the AV node and bundle of his. So AV node and bundle of his are slowly doing their work, very slowly doing their work, which causes a isoelectric line PR segment. So it almost feels like they're doing no work. Okay. And P plus PR segment, this whole time interval is called the PR interval. So I'm going to tell you how people, because people confuse it a lot. So segment is smaller. Okay, interval is long. Didn't you wanted your lunch intervals, yani lunch breaks or intervals to be longer? So PR interval is long and segment is a smaller part of it. Okay. So again, the same thing is written here. PR interval is P plus PR segment. And do you remember I said heart rate is 3 to 5 big boxes? Another hack. PR interval. This is going to be so important in upcoming lectures. PR interval is 3 to 5 small boxes. Okay, these two things you have to remember so nicely. And if millimeters we converted into seconds, it'll come to 120 to 200 milliseconds. Okay. Usually in ECG reports, they are written in milliseconds. But if you want to count it by yourself, you can see 3 to 5. Otherwise, you can see the numbers. So PR segment again, physiological AV nodal conduction. Okay, let's continue forward. Did everybody get the P wave nicely? Like, I really want to confirm it. Can you send me some thumbs up or something that you guys got it?
Yes.
Okay. Ruben, did you get it? Paul, did you get it?
Yes, ma'am.
Okay. Okay. Amazing, amazing. So QRS segment. छोटा छोटा सा part we have left only. ज़्यादा time भी नहीं लगेगा. QRS segment. I used to get confused a lot in this thing कि भाई QRS segment में what is this? What is normal and what is narrow? What is the difference? It's just the same thing, okay? Normal QRS segment is equals to narrow QRS segment, which is 2 to 3. Okay, don't even remember it. Just remember 3, okay? It should be less than 3. Okay, don't remember 2 to 3. Just strike it off. Just remember less than 3. So wide QRS will be more than 3 mm. Okay, this is very important in upcoming pathologies. You can see wide QRS. So why does wide QRS happen? Wide yani it's taking more time, right? And why it is taking more time? Because maybe because conduction is not happening through the conduction fibers and um, the impulse is going through muscle fibers, okay? Or the impulse is going in some opposite direction here, there, haywire is going on. So something abnormality just have this wide QRS complex, okay? So what is going to happen? QRS is very interesting depolarization. So do you remember I told you about there is AV node somewhere, and then there is bundle of Hills, and then there is left bundle branch, and then there is right bundle branch, right? So impulse is coming from SA node towards AV node, and then from AV towards bundle of Hills, and then the septum depolarization happens. So very interestingly, the septum depolarization. So this is the septum of the heart of the ventricles. Septum depolarization happens from left to right. Left to right. Okay. Now I want you to look at two leads. One is V1 and one is V5, V6. So you remember V1 was here somewhere, V5, V6 was somewhere here. तो ये हार्ट को हमने ऐसा कट सेक्शन में देख रहे हैं. This is your left ventricle, this is your right ventricle, this is your septum. So again, V1 is here. Positive. So it's coming in this septal depolarization is in this direction. So positive charges are moving in this direction towards V1. So in V1 lead, what we will see, positive towards positive, there will be a chota sa positive deflection. Okay. And in V5, V6, so this is your exploring electrode. So almost, यहाँ देखो. So V5, V6, मैंने वेक्टर थोड़ा सा गलत बनाया हुआ है according to the shape of the heart. So this V5, V6, it's moving a little bit away. Okay, ये दिखने में थोड़ा नीचे जा रहा है, but it is actually going something like this. Let me move it. Otherwise, you guys will be confused. So this is your septal depolarization, and this is your positive electrode. So first, this will go like this. Okay. So this is your Q wave. Never mind. We'll write the nomenclature later. So this is just your first part. Septal depolarization left to right, In V1, we'll see upward deflection, and V5, V6, we'll see downwards deflection. Okay. Now, second, what happens is the impulse reached to the ventricles. Okay. Our ventricles will start to depolarize. So ventricular, all this area will depolarize. Right ventricles will depolarize in this direction, and the left one wala is gonna depolarize in this direction. The thing is, left ventricle is more thicker as compared to the right one. So one vector is in this direction, one vector is in this direction. So the resultant vector will be towards the left ventricle. Got it? So this is your positive electrode, and this is your resultant vector. So in V1, what will happen? Positive is moving away from positive. So that's why this positive is moving away. So we will have downward deflection. Okay. What about V5, V6? Positive is moving towards positive. So we'll have a very nice upward deflection. Okay. Then the third thing which happens is the third event. There will be depolarization of the posterior wall of heart. See, it's going backwards. It is very far away for V1 to capture it, so V1 doesn't capture it, so we don't see anything. But for V5, V6, you see, positive charges are moving away from positive, so we are going to have a negative thing. Did you guys get it? Did you guys get the QRS concept? Because this is very important.
Yeah.
Yeah. Okay.
Wait, so does the positive charge mean that it is in repolarization
There is
and the negative
depolarization.
mean that it's in depolarization?
Repolarize. It's negative is repolarization. I'll get to it. I'll get to the repolarization wala part. See, it's here. Uh, where it is? This T wave. So T wave is because of repolarization. I'll explain it to you. It'll come. Don't worry,
Oh,
Jana.
negative is repolarization.
Yes, negative is repolarization. Positive is depolarization.
Uh,
Yeah.
okay, okay, okay.
Okay. So when you will study for your sixth year exam, there's gonna be some pathologies where you will see R/R, something like that. Some small r, big R, some pathological names of some pathological QRS complexes. So that's why I want to tell this thing to you here itself. Chota sa, and we'll do a small exercise also. So nomenclature of QRS. See, first of all, what you're going to do is you're going to find out the first positive wave, and we are going to just blindly going to call it as R wave. Okay, and anything before this R is Q, and anything after this R is S. As simple as that. First positive wave R, before it is Q, and after it is S. And what if you see two positive waves? So first one is R and next one is R dash. Did I get you guys? Did you guys understood it? I'll assume it as yes. So so for this first V1, let's solve it. If there is a small amplitude, we'll write the small letter. If we have a big amplitude, we'll write the big letter. Okay. So first positive wave, this one, we see. So this is and chota amplitude, small amplitude. So we'll write it as R. And then anything coming after R, what it is? S. So it has a big amplitude. So we're going to write it as like this. About the V5, V6. First positive wave, see this one? We'll call it as, it has a big amplitude also. We'll call it as R. And before R, there is this small wave. This is Q. And there is this another small wave. There is this S. So this is QR. What about this one? do you guys think? I would want you guys to write answers for me in the chat for these three. So the first one, this is the first positive wave, the only positive wave. So we'll just call it R.
Or
Yes. And this second wala, you see the first positive
small,
wave. So this is chota sa amplitude. We'll call it R.
big
Then
S,
there is this, yeah, after R, anything after R is S. Okay, correct. Big amplitude, so big S, and this another R is there, so R
small
dash.
R
Yeah,
dash. Okay.
amazing. If you got it right, then it's amazing. So
Mm,
first wave, this is small amplitude, so this is R, and then there is
small S,
another positive wave. There is
O
R
positive.
dash. That's all.
R dash.
Finished.
Okay.
Did you get it? Did you get it right? How many did you get right?
Two. The first two.
Good. The third one is little bit thoda sa confusing-ish. So yeah,
Mm.
good, good. You're doing good. So do you remember the QRS axis, some bullshit like that? I told I'll have to cut this part if I put. Sometimes, the real feelings come out because I don't like this axis shit. What is this? Yeah, no use. Just do a eco. Okay, never mind. Okay, we still need to study it. So lead number one. You see, we took it as x-axis, AVF. We took it as y-axis. So usually when we see the heart, we are trying to find out the resultant direction of the vector of the heart. So I told you, right? It's in this direction. So it is usually it looks somewhere like this. We have been drawing this since past 40-45 minutes, right? So how do we decide ki if the heart's vector direction is normal or not, if the heart is working or not, working normally or not? Yeah. So from so this is plus. I'll have to show it again. This is plus and this is plus. So anything going above this plus is going towards the negative direction. So all of this is negative. So this is from negative 30 and this is 0. So this is 90 and after 90 it is 110. So anything from minus 30 to positive 110 degree, it is normal vector of heart. So anything going above minus 30 is left axis deviation. Okay. Anything going below, yani more than, or you can say more than 110 is right axis deviation. So how do we find this left axis, right axis, all these bakwas? First, I'm gonna teach you some technical bullshit, and then I'm gonna just tell you the trick which will solve all of your questions. So, just for the sake of telling, I'm telling you some technical stuff, how to find the axis. So, this is a wave, right? This is a QRS wala wave. For example, this is 10 mm, okay, and this chotu sa is 2. So the total, this is negative, this is positive. So total it'll be 10 minus 2, it'll be 8, right? In this one, this is, for example, 10. This is again 2, and this is again 2. So it'll be 10 minus 2. How much it'll be? 6. Again, for example, this is 10 downwards, minus 10, and then this one is 2. So minus 10 plus 2, it is minus 8. And what we are going to do is we are going to plot this thing on this graph. Okay. And which leads we will take? Again, lead 1 we will take and lead AVF will see. So what we'll do is ECG error. So lead 1 ka QRS you're gonna see and lead AVF ka QRS we are gonna see. and उसमें we'll calculate the amplitude and we will plot the amplitude on this graph and then we'll find out. For example, lead 1 में I got +3 and lead AVF में I got +8. So I'm gonna plot this graph. It meets here. So this is the direction and this is the angle. Did you get it? And for example, in lead 1, I got -10. And then in lead AVF, I got plus, for example, +10, -10. We'll plot it here like this. So this will be the vector. So it will be right axis deviation. Yani the resultant vector is in that direction. You know what? Why does it happen? Because when there is, yani if more muscles are contracting, so there will be more depolarization, right? So that's why the vector will shift towards that direction. So when there will be more muscles, there can be more muscles because there is hypertrophy of the heart. So for example, if there is hypertrophy of the right ventricle, so the vector will have right axis deviation. If there is hypertrophy of the left ventricle, the vector will have left axis deviation. And if something crazy is going on, we will have extreme axis deviation. So this is extreme axis deviation. So let's plot it. If lead 1 is uh, negative, AVF is positive, we'll have right axis deviation. And it usually happens with right ventricular hypertrophy. So thoda thoda we are getting into pathology wala part. So lead 1 negative है, इसका मतलब क्या है? QRS will see more like this and AVF positive है, इसका मतलब क्या है? Like this. So you see both of them are reaching. So that's why right axis deviation with reaching QRS seen in right ventricular hypertrophy. So RRR, right axis deviation with reaching QRS seen in right ventricular hypertrophy. And opposite, we are going to see it for left axis deviation. Left axis, lead 1 is negative and AVF is, what did I do? Did I do something wrong? I think I wrote something wrong. No, the lead 1 is supposed to be positive. Please correct it here. Okay, so lead 1 will actually be positive and AVF will be negative. Some people who must be just reading the notes only, they'll be like, yeah, ma'am ने तो कुछ ऐसा गलत लिख दिया. Sometimes just human errors. So here it will be negative. AVF will be negative. So the vector will be in this direction, left axis deviation. Let's see, lead 1 was positive. This is your lead 1. AVF was negative. This is your lead AVF. So left axis deviation with leaving QRS seen in left ventricular hypertrophy. So L, L, L. So you see the both QRS are in opposite direction. They're trying to leave each other. So left axis deviation leaving QRS seen in left ventricular hypertrophy. Now extreme axis deviation, yeah, so it happens in two cases. Either this person sitting in front of you, you're trying to auscultate and you'll feel like this person doesn't have a heart because he has dextrocardia, or just the lead are placed in wrong direction. So if you're going to place right-sided chest leads, you're going to see this extreme axis deviation. So both will be negative, AVF and lead 1, and we'll see extreme axis deviation. Is this point clear? We are just about to finish the class 2. So what is J point? J point is just is important to find some pathology. So it's just a point that we named in ECG. Okay. So where is our ECG? See, we studied P, we studied QRS, and where this QRS ends and ST segment starts, this is our J point. And after QRS, there is depolarization. Now the repolarization phase will start. Okay, so repolarization will be from थोड़ा थोड़ा तो यहाँ से शुरू हो जाएगा एंड चलेगा पूरा यहाँ तक. Okay, so interval always longer. QT interval. It starts from Q and ends towards the T. And ST segment will be, it starts from S and ends with the starting of T. So ST segment is very important. You're going to see it in heart attack patients. So make sure to remember this ST segment वाला part. ये J point पे शुरू हो रहा है and then it is ending at the T का starting. So we'll see ये कैसे हो रहा है ये सब. So J point is between QRS and ST segment, and where do we feel कि for example अपना ECG ये QRS ऐसा बना दिया और ऐसा करके और फिर ऐसा यहाँ पे T आ रहा है, तो इसमें J point कहाँ पे है? So do you remember I told about PP segment? So from one P to another P, from starting of one P to starting of another P या फिर ending of one P to ending of another P, एक लाइन ड्रॉ करेंगे. इसको हम बेस लाइन ऑफ ईसीजी कहते हैं. एंड इस बेस लाइन पे जहां पे अपना ये वेव वापस आ जाएगा ना, दैट इज योर जे पॉइंट. डिड यू गेट इट? आई विल assume that you did. So ST segment, I told you, ST segment में isoelectric line is there because there is no activity. For some time, heart is just wanting to chill out. It did a lot of work. And then in T wave, there will be repolarization of heart. So in repolarization, if you remember, the heart comes back to its resting membrane potential, and resting membrane potential is negative. Okay, so what is happening? छोटा सा concept I'll tell you because I don't want you guys to be confused. Do you remember depolarization के हमने वो ऐसा left ventricle right ventricle diagram we made, and then depolarization I was telling you like this, inside to out. But repolarization is ulta. It'll go from outside to inside. You see? So repolarization from outside to inside. So ventricle का repolarization we'll see because it's a big event. पूरा इतना बड़ा ventricle है. We have big ventricles. So the resultant vector is in this direction. The negative charges are moving towards negative. Do you remember what we studied on the first page? So we are gonna have this positive deflection, and this is your T wave. And अपना QRS complex also. Why I didn't write it? Plus QRS. Okay, so I have some questions in front of you, and I would like you guys to solve them. Take 5-10 minutes, and then I want you guys to see how much did you got right, because this is the gist of the whole um, 1.5 hours that we have spent together. So please try to solve these questions and let me know your answers. सबसे पहले question, heart rate, if it's bradycardia, if it's tachycardia, if it's normal. So we are gonna look at the most famous lead. Okay.
Mm.
So this one it is. From the top of the R towards this R, we'll count the boxes. 1, 2, 3, 4, 5. So यहाँ पे there's one box extra and then there is one box less. It's approximately 5 boxes. So 5 boxes. Is it bradycardia? It is tachycardia. Is it normal? So this patient is, yeah, it's normal. It's almost approaching bradycardia. Okay. If you mark bradycardia, you're correct. If you mark normal, matlab, it's also correctish. But this patient is approaching bradycardia more. Okay. Now I know this is a tricky one, thoda sa. So even if you uh, take normal, that is also okay. So you can give yourself 1 point for this. So the axis is normal or not. So just look at two leads, lead number one and lead number AVF. This is above, this is above. So I did not discuss this with you, or did I? So are they reaching? No. Are they leaving away? No. Are they both down? No. So all any other variant, both are above. So this is normal axis. Okay. So the axis is normal. So if you uh, mark normal, you can give yourself 1 point. Now spot the wave, P wave in lead 2 and lead V1. So do you remember in lead 1 in this side, we read the wave is just like this, a very smooth one. And in this V1, we saw the lead is biphasic. So we'll try to spot it. Okay. We'll see the lead 2 का नीचे वाला diagram. It's much more better. So let's zoom it in. It's थोड़ा थोड़ा blurry, but you'll still see it. So look at this, starting from here till here.
Mm.
This is your P wave. And can you count the number of boxes? This is almost two boxes. So from here to here, almost two boxes. So this is a normal P. Let's mark it in where it is. V1 kage. Oh yeah, V1. So do you see the biphasic wave? Uh, one second. It's very chota sa visible, but do you see this wave?
Yeah.
There's a upward curve and then there is a downward curve. And if you calculate the interval, it is also again almost two boxes. So this is normal. If it is more than 2.5 boxes, this is abnormal. But now if you mark these both things, you can give yourself 1 marks. And if you just did one, you can give yourself one it's 0.5. So what about P in lead number one? What's happening? What happened? So
See.
ये ऐसा notch सा क्यों दिख रहा है? See, there is a notch-ish.
Yeah.
So do you remember I told you in lead? हाँ बोलो, Ruben. कौन से में? कहाँ? Third question में P in which one? Lead कौन सा?
V1.
It's biphasic. ये देखो ना, ये देखो. हाँ, biphasic. See, ये देखो, ये दिख रहा है biphasic? Yeah, this is your biphasic. बहुत छोटा सा दिख रहा है. ये देखो, this is your biphasic. V1 में.
What does
अपन लोग
biphasic? No. What
क्या?
does it mean if it's
It's going
biphasic?
up and then it's going down. It has two faces
Okay, that.
in simpler terms. Yeah.
No. No, like if it's like, is that a thing that we should be worried about?
No, this is
Like,
normal.
हाँ ठीक है. And it
अभी
doesn't
अपन
cancel out
सिर्फ
each other.
normal. Pardon?
Okay. No, it doesn't cancel out each other either. You just add them both.
No, we are not going to cancel out because they are occurring in different time. You see, the time is moving like this.
Yeah.
Do you remember?
हाँ. Oh
यहाँ
yeah,
पे
yeah.
हमने ऐसा हार्ट का बॉल बनाया था, फर्स्ट राइट एट्रियम, फिर उसके बाद डिपोलराइजेशन जाएगा लेफ्ट एट्रियम की तरफ. So these
Hmm.
two events are occurring in different time interval. That's why you'll see these two different waves.
Okay,
Waves.
okay.
थोड़ा थोड़ा ना बीच बीच में ऐसा बिहारी एक्सेंट आ रहा है. Babes, babes. So I wanted to ask you guys an interesting, tricky question if you will be able to solve it. This you'll see P wave looks थोड़ा ऐसा ऐसा. You see this here? You see this here? So why do you guys think so? But it is between it is 2 mm. So the width is normal. So why do you think so? If anybody has answer.
नहीं पता।
Okay, I'll tell you. थोड़ा थोड़ा वेरिएशन की वजह से. हाँ बोलो. Do you have an answer? No, it's not a pathology, it's normal. अगर 2.5 से P कम है, तो it's normal. So why थोड़ा सा ऐसा सा दिख रहा है, notch दिख रहा है? Because do you remember I told you vertical P में, देखो ये ऊपर जाओ, ये देखो, कहाँ है? P, where is P wave? ये देखो, P wave में मैंने पहले किसका बनाया था? राइट का बनाया था, फिर उसके बाद मैंने लेफ्ट का बनाया था. एंड देन वो जॉइन होके एक सिंपल दिख रहा था. अब यहाँ पे
Oh,
बिकॉज ऑफ द प्लेसमेंट ऑफ द लीड वो थोड़ा सा सेपरेट सेपरेट दिखने लग गया है. दैट इज द ओनली थिंग. सो दिस इज अ नॉर्मल ईसीजी. ये नहीं सोचना हॉ इसको तो अभी हम आगे पढ़ेंगे कि हॉ इसको तो लेफ्ट एट्रियम enlargement है या राइट एट्रियम enlargement है, कुछ ऐसा करके नहीं सोचना. So this is
mhm.
normal. Okay, that's why I'm telling you normal ECG. It's very important. And the next one, chalo. Is the PR interval prolonged? PR interval क्या होता है? 3 to 5 small boxes. So did you check the PR interval? Is it prolonged? Let's check in lead 2. So यहाँ से शुरू करके यहाँ तक. So it is 1, 2, 3, almost 3.5 small boxes. So 3 से लेके 5 के बीच में आना चाहिए ना small boxes. 3.5 small boxes. This is normal. So PR interval is normal. So if you mark normal, then you can give yourself 1 point. Is QRS narrow or wide? Let's see in lead 2. कौन से वाला देखूं? So let's look at this one. QRS should be less than 3, right? So अपना QRS देखो 1 mm का है. So this QRS is normal. So normal QRS is called narrow QRS. Is AVR normal? Let's look at the AVR lead. Normal ECG में हमें कैसा दिखता है? P wave, QRS and T. अपना AVR कैसा दिख रहा है? ये रहा P wave, नीचे की तरफ QRS और ये रहा T, राइट? P इसमें कहाँ है? ऊपर है. P is up. And do you remember AVR was the outcasted lead? सब यहाँ जाएंगे तो ये यहाँ जाएगा. तो ऊपर जा रहा है P, तो इसमें नीचे जाएगा. QRS यहाँ ऊपर जा रहा है, इसमें QRS नीचे जाएगा. T वेव इसमें कहाँ जा रहा है? ऊपर जा रहा है, इसमें T वेव नीचे जाएगा. और ऐसा क्यों था? बिकॉज ऑफ द डायरेक्शन ऑफ दिस लीड. Okay, so if you marked it as normal, you can give
Okay.
yourself 1 point. क्या बोले? Team?
No, no, I got that it was normal, but what I did was I compared it with lead 2, and then I just
Yeah.
checked if it was similar, you know, just the opposite. Is that enough?
Ah,
Okay.
if you got it right कि if it's normal, yes, it's normal. इतना मत सोचो because थोड़ा थोड़ा लीड भी इधर उधर है तो हल्का फुल्का थोड़ा सा वेरिएशन आता रहता है एम्पलीट्यूड का.
हाँ.
You get me?
No,
Because one lead is here, one lead is here, तो थोड़ा सा एम्पलीट्यूड का भी डिफरेंस आएगा.
yeah. No, I thought AVR was exactly the opposite of lead 2 or something.
हाँ,
There
it
was some.
is.
Oh, okay, okay.
It is. It is. See, यहाँ पे this is ये जो मैंने बनाया है, this is lead 2.
हाँ,
This is
okay.
AVR.
Okay, okay.
Okay,
I got it.
let's continue. Best lead to spot diffuse ECG changes. इतने टाइम से हम lead to का गाना गा रहे हैं. So this is lead number 2.
Yeah.
Okay, because lead 2 and somebody asks you, excuse me, why? So the people whom I teach should know कि lead 2 is in the same direction of the vector of heart. That's why lead to maximum deflections and lead to best to see problems in ECG. Name QRS in V1 and V6. So V1 का QRS हम लोग कैसे देख रहे हैं? Just कहीं पे शादी हो रही है मेरे आस पड़ोस में. Can you guys hear the drums? So V1. First वाला is छोटा amplitude, so small r, and anything after r is बड़ा amplitude है, so that's why I will have it as S. So if you wrote it correct, give yourself 0.5 marks. V6. You'll see. इसमें यहाँ पे दिख रहा है छोटा सा, इतना छोटा सा नेग्लिजिबल सा लग रहा है मेरे को तो, जो Q है. Anyways, so this one. This is big deflection. This is capital R, and anything after R is S. So if you got it right, you can give yourself 0.5. Let's go forward. So normal heart rate, I asked you. It's 3 to 5 big boxes, 3 to 5 small boxes. Of course, it's gonna be 3 to 5 big boxes. If you marked it right, you can give yourself 1 point. 10th one is spot the J point in lead 2. Were you able to spot the J point? Because J point calculate करते हैं from the baseline of ECG. यानी from starting of P, एक imaginary line if you draw, okay, your J point will lie there. So somewhere here, this is the J point. Okay, so this is your J point. If you marked it right, you can give yourself 1 point. So can I know in the chat, from starting of P to another P, we'll draw imaginary line. Okay, imaginary line draw कर दी हमने. अब ये जो QRS वापस आ रहा है, ये QRS चला 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 यहाँ से वापस आया, and the moment it meets our baseline of ECG, this is called the J point. Did you get it? This J point is nobody's gonna go and ask you in ECG कि इसमें J point बताओ. This is a theoretical thing to help you understand another concepts.
Okay.
But this ECG is a very confusing concept because many people उनको ये होता है कि यार ठीक है पढ़ तो लिया but they will still not remember it. And the good part is you guys came and you guys are leaving with something in your head. And if I would want to ask you कि would you be able to diagnose a normal ECG now, keeping some things in head? Yani heart rate. You'll see heart rate, bradycardia hai, tachycardia hai. You'll see the P wave if it's normal or not. Just look at lead 2, look at V1. Are they normal? And what else? Huh, P wave dekh liya. QRS you'll see if it's narrow or if it's wide in lead 2. T wave you'll see. T should be upwards. Okay. And yeah, that's all. और क्या देखना है तुम्हें? एक्सिस देख लो, एक्सिस कैसा है. लीड 1 if it's going down, और अगर AVF में ऊपर जा रहा है, रीचिंग है, तो it's right axis deviation. लीविंग है, तो if it's left axis deviation. दोनों ही डाउन है, जिंदगी बहुत डाउन चल रही है, तो it's extreme axis deviation. Just ये छोटा छोटा चीज देखना है and you'll understand if it's a normal ECG or not. And PR segment, PR वो देख लो, PR interval देख लो. That's all. And then you'll get to know the normal ECG.